A herniated or ruptured disc can be one of the most painful and life-changing back injuries. Discs act as shock absorbers for your spine, and because of age or a specific physical activity, a disc can rupture. Dave Anderson is a 51-year-old flight control engineer from St. Charles and an avid runner.
My back was starting to bother me back in, say, early 90s, and then the doctor said basically you need to get more active and start doing exercises. So I started getting active about 1996 and started doing calisthenics in the morning and started to run in the morning. We had a sleet storm right around February 1st of this year, and I was out trying to shovel the driveway before it froze solid. And I got about 2/3 of it done, and I had leaned over, filled up the shovel, and then twisted. And right then there was a pop on my back, and I immediately stood up straight and said, "That's not good."
Dave's neurosurgeon is Dr. Stanley Martin, a specialist with over 20 years of experience treating back problems.
A herniated disc is an affliction. The disc itself is a disc-like structure with a more solid outer rim, and the inner part is more fluid, like crab meat or lobster meat. And the way I think of a herniated disc is that the outer part tears and the inner, more fluid part shoots out through that tear and can cause symptoms.
When the inner gel-like fluid leaks out of a disc, it can put pressure on the spinal cord, causing pain, numbness, a tingling sensation down a leg, or other symptoms. Risk factors for a herniated disc include age, smoking, repetitive strenuous activity, or excessive body weight.
About half the people I see can point to a specific event. They lifted a refrigerator or they helped their parents move or things like that. The other half can't point to anything. They wake up in the morning and the symptoms start at that time.
The symptoms were that there was pain starting on my backside and going all the way down my right leg. It just was constant. You couldn't move in a different position to feel better. After a couple of days, it kind of settled right in like somebody kicked you in the shin and didn't go away.
The diagnosis is made clinically from a typical story, typical history, and corroborated by physical exam findings. And then we tend to try and confirm the diagnosis with an imaging study such as a CAT scan or an MRI.
They saw one bulging disc that they didn't think that was much of a problem, but then there was a big rupture that the MRI showed between L4 and L5.
Once a diagnosis is confirmed, treatment can range from pain medications, physical therapy, and epidural steroid injections to surgical options like a microdiscectomy.
A microdiscectomy is a treatment for ruptured disc herniation. It's an operation that takes usually a little less than an hour and has nice success rates.
In a microdiscectomy, the surgeon makes a small incision in the lower back. The use of a special microscope allows for a good view of the area around the rupture. Before the disc material is removed, a small piece of bone from the nearby vertebra, called the lamina, may be removed to get a clearer view of where the nerve is being affected. Using microsurgical instruments, the surgeon removes the herniated material and any fragments of the ruptured disc that are causing pressure on the nerve. This surgery often is done on an outpatient basis with an overnight stay.
The recovery time after a lumbar microdisc operation is taken easy for a bit, not lifting heavy things, trying to avoid bending, twisting, or stooping as much as you can. You certainly walk and do stairs. That's not a problem. People are off work depending on their type of job. A sedentary job would be typically off for several weeks to a month. A more physical job would be off 6 or 8 weeks. I think the prognosis for a lumbar microdisc operation is very good. I'm pretty careful to tell people that it's not expected to take all their pain away, and most people will have some back pain after the surgery, but they tend to do, I think, very well.
So after a week, I felt pretty good, and I went out and walked 4 miles. And in 2 weeks, then I started to run. I had qualified for the Boston Marathon the previous year. Boston Marathon's the only one you actually qualify for, so you have to get into it. You can't just sign up and do it. So I really, really wanted to do the Boston Marathon. I was very happy with Dr. Martin. He was a friendly guy, and I could ask him straight questions, and he would give me straight answers.
I take care of everyone like I would my family. I don't think of people as just a number or a client.
Everything worked out, and I was very, very happy that the surgery worked so well, and Dr. Martin did such a great job. He's basically my hero, if you want to look at it that way. And then I was able to push myself to actually do the marathon and complete it. This is my medal from completing the Boston Marathon 2 months after the surgery with Dr. Martin. This was the goal, and I was able to get it done because of successful surgery and recovery.
SSM Neurosciences Institute provides a full complement of diagnostic and treatment services for back problems. For a referral to an SSM neurosurgeon, call 1-866-SSM-DOCS.